Welcome back, friends, to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. John Silva. How are you, doctor?
I'm doing well, thank you.
Great. I know you're very, very busy this time of year. So.
Yes, absolutely.
Well, we're talking today about how to choose a primary care doctor. So you are a primary care physician with Covenant Medical Group, also known as a family doctor. So tell us the role of a primary care provider.
That's a good question. I think an easy answer is that we give the best quality care for every patient, making sure they live as long as they can.
Yeah.
But I think it's much more than that. I think that we're the first line of defense in case something were to happen. I think that our job is to help prevent, to help treat, and if needed, if a disease or an illness, or in case we had to refer out to another provider, what we would call a specialist, our job is to be that first line to be able to do that. So in the end, though, our job as a whole is that first part in a long line of healthcare providers to give the best quality medicine we can.
I love that. You get to know the entire person.
Exactly.
So let me ask you this. So if someone's trying to decide the best primary care physician for them, what are some things that they should know or what they should ask, the questions they need to ask?
That's a great question.
Yeah.
I think that the first step is determining if the primary care provider can actually even take them. So I think that a lot of times with insurances, even today, there are a credentialing process for every provider. And so certain providers don't even actually take all insurances. So I think that by either notifying their insurance itself or by calling up the doctor's office to see if they're taking their insurance, because that's usually the first question that's asked. Right. Another thing is that certain providers won't see specific patients, such as those under the age of 18 per se. So it would be important to know that if I wanted to see a certain provider, you have to make sure that they're even going to see them, number two. Number three is that if a patient has seen a provider in the past and now they want to see a new doctor, it'd be important to have their old records for that new provider to give good quality care, just like the first provider did.
That makes a lot of sense. So fall right around the corner. You know, school is starting for so many people. Oh my goodness. So what are some things that even healthy people should know this time of year?
That's a great question. So every year, I think that it's important to be updated on labs and have an annual physical. For those that are under 18 years old, we call them well child checks, especially with school around the corner. It's important for parents to get their kid in every year for an annual physical, screening tests. Certain schools require immunization, so vaccinations. And certain children are going to be doing sports, so doing something what we call a sports physical would be important too, not just done by a primary care physician like a family doctor like myself, but also urgent care providers are able to give that type of a service as well. So I think just being able to get in for physicals, getting for immunizations, making sure their labs are up to date, just making sure their care is always pristine every year.
Yeah, that's always on my summer to-do list. Make sure I get the kids vaccinated, make sure they're up to date on everything.
Correct.
You know, their sports physical. Okay, so if someone wants to find a Covenant Medical Group doctor that's accepting new patients, what do they need to do? Great
question. So being through Covenant, we actually have a Covenant directory, so you can actually go through the Covenant website and search any doctor based on their specialty with actual comments given from patients based on the quality of care that they were given. And I believe we might have a number at the bottom of the screen later today.
It sure is right there.
Great, excellent. That they can call and see what physicians like myself are actually taking new patients, and then to judge for themselves through the website and the directory if that's a right fit for them.
Yeah. Well, I can tell you love what you do and you're passionate about it. Why is it that you enjoy being a family care physician?
That's a wonderful question. So being from Saginaw, it's great to be back, to give back to the community that helped raise me, and to see those patients and their children for generation after generation being able to give back. And at the same time, also seeing the fruits of the patient's labor. So if you're encouraging a patient, if you're teaching a patient, really pushing them to get the best quality care, and then you're actually seeing them get healthy, it's really special to know that you were part of that, to be able to help them. And it's just been a real special treat for me to be back here to provide that kind of care.
Yeah, and I'm sure it's so rewarding to see people go year after year, and you're part of their family.
Absolutely.
Yeah.
It's great. And to be back in the city that it started in, it's a real special treat for me.
Well, we are so happy that you're here. Thank you so much for what you do. I know sometimes it can be rough and tough, and so many things are happening now, but we appreciate you.
Hey, I appreciate
so
it.
much.
Thank you for having me.
Of course, you're so welcome. If you would like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.